19 вересня продовжую роботу.
19th of September, Media Center of Ukraine continues its work. My name is Tonkoshkurenko. We're continuing talking about the tactical medicine, and we will be talking about the responsibility of business in terms of safety of work. And I will present to you Fedorovsky. He's head of the training center for the tactical medicine, and also Olena and Diana Zinkevich will join us later. They represent the battalion hospitaliers, and the Serhiy Soshinsky, president of the International Charitable Foundation, Health of the Ukrainian People. And I would like to first talk about the reforms that are implemented in our country in terms of security of workplace and safety of work. What are the challenges and what has been implemented? Thank you. So in this block, we would like to cover the questions of governmental policy in terms of safety of work, and I would like to emphasize immediately that when in other directions of associations activities there is palpable achievements from cooperation with different stakeholders, then in the field of security of work, safety of work, we don't have any kind of achievements. And what I'm talking about, as of today, Ukraine has different requirements as for the safety, and there is also training courses for the workers in the domain of safety of work, and this is also this is also it says in the norms that there have to be first aid kits, and our investigation showed that this is all just formal and no practical implementation. So what the people are having are just signatures that they have finished some kind of courses. So formally, and for example, formally the first aid kit that is that is required by the law of Ukraine. It does not cover any kind of necessary things that are required during necessary time. And in public places, in governmental organizations, people have to have opportunity to have access to the first aid. And we will be talking about this later. This is the project that gives the opportunity to the people without the preliminary knowledge to receive online or offline, and also receive the possibility to have access to the first aid kit using which you can stop bleeding and other adjacent injuries. And we're hoping to achieve some kind of governmental norm in terms of first aid kits. So how it is different, how the first aid kit has to be, and how it is different from the one that is described in the legislation field. The problem is that the norms that were written about the first aid kits, those are norms of the late USSR, and it has included the means that have to act without regard to its functionality. So, in terms of stopping bleeding, there could be a quality tool that stops the bleeding, and some of the tools can be non-quality, and those instruments, those means can actually injure people. So we are seeing these products in retail chains, and we see those online, and it is considered as a solution of the problem. Mr. Olena, let's talk about the for example, bleeding, because we already mentioned it. What does the project implement? Let me start with the first aid kits in the companies. So every company has their own statutes, and they're procuring first aid kits and they're buying first aid kits that contain Validol, for example, like a heart disease medicine. And this is really strange, because Validol will not help with stopping the bleeding, and we are really glad to join the project Stop the Bleeding. And the means that are included in the first aid kits are the squeezing means that are used for stopping the bleeding, tampons, and some non-critical bleeding. I think this project is very socially important. It will help to save many lives. Let me give you an example. There was a news piece just recently about a girl in New York who was bleeding, and people couldn't help her anyhow because nobody could help her. Last year we had the same story in Kyiv on funicular. Yes, exactly. And we don't have those means accessible in public places, in companies, in production facilities. So Mr. Leonid already mentioned the rubber from your underpants. So if we're talking about the norms that were taught in the USSR, everybody was learning those first aid things in school, and it was just a rubber band previously. So is it a method, or is well, I think such bleeding that we are facing right now, it didn't happen previously. So okay, tell us about the project Stop the Bleeding, and what are some successful moments that you can talk about. I will touch upon this briefly, because Leonid can talk more about it. So the existence of the first aid kits for stopping the bleeding, specifically for stopping the bleeding in the places of education, in social gathering places, and all where it is required. The project also aims to teach a person that was not previously taught about the first aid. They can, using a very simple interface, average person can understand what they need to do. So even dependent on who is receiving the help. So this is a very socially important and critical project. Mr. Leonid, tell us more about it, the interactive component. How does it work? Well, first of all, I cannot pass on saying that a very huge plus and huge thank you to Miss Olena is that the means that you see in this set are the means that are produced. These are the products that are produced by Ukrainian manufacturers. So previously it was all about foreign producers, and because it was considered like a better quality. However, Ukraine has been producing these things and the very quality ones for many years. We haven't yet started doing the rubber gloves, but this is the only thing. I would like to say that everything that's included in this first aid kit is produced in Ukraine. And I would like to stop on this moment that many people that are having knowledge received in the training courses or in volunteer initiatives. However, when we're talking about massive traumas, people have to have resources, and this is this is something that we are aiming at, is to make those resources accessible publicly. And us and our partners, we already agreed upon that we have to change the set of a first aid kit. We will change it if a user can prove to us that their change is viable. So there is an online course for training. All people could undergo public, free of charge course that is supported by our partners. These are also public trainings that people can attend any time. So we are trying to weaponize, in a positive sense, our citizens with the whole range of the arsenal of the first aid means. And we would like to make this process to achieve such a level that in every city, in every town, in every convenient or a public place, there was a tick that people there are trained to provide first aid. The cost of such a set is for around 4,000 hryvnias, and taking into account the situation on the market in Ukraine, this is a product which is actually much more cheaper than the military first aid kit. The producers heard our demands or requirements, and they satisfy them. So if we're talking about the term of validity, it's 2 years. It has to be renewed every 2 years, and our digitalized infrastructure allows us to track this time. So I'm addressing two business representatives right now. You don't have to think about it, because we will find you on the map that your first aid kit has run out of time, has run out of lifetime, and we will put a notification to you. So another question about this first aid kit. We have certain risks. You said that we have everything produced in Ukraine. However, there is a risk of attacks from the enemies, and they are targeting critical companies, critical producing facilities. What can you? How can you comment on this? Well, this is a very complex question. The team keeps working with the Ukrainian producers, and it is with a high probability there will be possibilities emerging to conclude agreements with different content. However, this is exactly the point of our project, that we're open for cooperation with any benevolent entities. If the business is ready to say that we checked this medicine and we are ready to work on it, we are ready to also cooperate. Are you working on making these first aid kits mandatory in terms of legislation? Like, for example, fire extinguishers, they have to be present in every facility, every building, every establishment. So, is there something like that about the first aid kits? As we said, the law of Ukraine about the first aid kits and its content and its spread around the facilities. So this is a very complex law, and we're working hard on it. And I'm hoping that certain requirements will soon appear as to how this has to happen. So as of right now, these are like more farther plans because right now, as a civil organization, we're not capable of covering all the requirements. Right now, we are only capable of showing how it's supposed to be done. I would also like to add that if when the government will see how this process actually works, it is quite possible that the legislation component of our government will actually get to develop practical laws about the first aid kits and about the content of these first aid kits. How was it selected? How did you choose the brands? How was the list created? What did you base upon? International experience? Well, you will not believe it. It's a super story. We have received information. One of our speakers cannot make it here. I'm sorry about that. However, when in America, and this was American project initially, when they had a problem in one of school campuses that the ambulance cannot get there in time, the American College of Surgeons within the framework of the experiment in one of the campuses initiated the project of bleeding stoppage, and it basically flew off, and it also was transitioned into Ukraine. However, this project is aimed at the American system of healthcare, and we with our colleagues from Ukrainian science, this at Bogomolets University, and also our colleagues from psychology faculty of pedagogical educational sciences, and we adopted the hypothesis that Ukraine has a necessity in its own authentic project, and that's where we started working. Serhiy very timely, so he will talk about how Ukrainian first aid kits are different from other kits, and we have basically achieved a possibility to create our own first aid kits, and it's basing on more aggressive help aid. So these are some tools that are best of the best, and like American variant is a little bit lighter. So we have Serhiy Soshinsky here in our studio, and we would like to talk about what is actually the difference between the Ukrainian first aid kits and other first aid kits of the world. What are the specificities? What are the nuances? And the main thing that we need to understand is that we live in the state of war, and correspondingly there is a lot of things that are pertaining to other worlds, like Western world and other foreign entities. It has to be adapted for our country. So we had a bet with him that he will shave if we teach 100,000 people, and so the main thing was to determine what is the main problem. Is it maybe education? In my opinion, the best and profitable situation will emerge, and the possibility to save people's lives will be present. So this project that we launched a year ago, this was the first training course of the stop bleeding, and it is an information component. It's not basically a scholar education, but it's education. And objectively, I can say that this science of adults education, it requires repetition. On the third or fourth time, I understood that it has rooted in my mind. That's how I understood how the process has to be built. Well, first of all, we need to inform everybody. First, everyone has to know this. Second, B, try it and C, repeat it many times. And this has to be different from the West, because our training course has to be much more covering, enticing, and I just don't think that the current training courses in the Western countries are adequate for the wounded that we're getting in the state of war in our country. So the bandages, the bleeding stoppage, and these things are only possible when a person knows what a bandage is or how to stop a bleeding. So this is how we built our training courses. So the online portion is the knowledge component, the theory. The people familiarize with for the first time in their lives, actually for the first time in their lives, get acquainted with the things that they will be working with, and then they come to us and they actually use it in practice. You can actually see how their world gets turned upside down, and after the fact, when I'm talking to them, everyone is inspired after this training course. There is not a single person that is negative about it. So for Ukraine, the training format had to be rethought in certain ways. So the medical aid in terms of understanding it as a conception was rethought in the conditions of our country that's being at war, and the experience that we are attaining is showing that it was a correct decision. So these things actually can stop the bleeding and save lives. Are there any quantitative rates that you can provide us to basically brag about it? Well, let me start bragging with the fact that I was here a year ago, and so I had bleeding stopped for me by Yaroslava, and it was a very significant event for us and for her, and it confirms another time that people, despite their social position, their position in the society, and despite what they are doing as a profession, they are quite distant from the first aid concept, and this concept, it has to be carried into the masses. Basically, people have to understand that living in this country and being here, being located here when attacks happen, you have to be basically ready for anything and know a lot of things to be able to help the people in need in emergency situations. When we're talking about the knowledge here, and in quantitative measurements, it's a few hundred people that passed these trainings, and I will remind you, the trainings happen once a month. Next Tuesday there is the next training. I invite everybody. You have to undergo the theory component. It is necessary now. And another thing that we as a team we learned to understand the importance of certain stages. I have undergone the theory, and then I went to practice, or somebody else that did not pass the theory. So after this, the instructors. After receiving the image of what people already know, the instructors devise the plan of education in a appropriate way, and so. When the people are receiving knowledge and then practical experience, and we are not accepting basically people to practical courses if they don't know the theory yet. So we are redirecting them to the training course that's focused on the theory. So there is no limitations in time for that, and so after that, a person is allowed to come to practical lesson. And after working with nails, without nails, on themselves, on the partner, so these things that the people don't have the opportunity to learn in any other kind of situation right now. So they have this opportunity at our training course, and if somebody actually decides that they want to continue learning more, they can. We don't have really like serious. We have a couple lessons that are more seriously have a more serious approach. However, we're more simple, because we cannot teach to stop bleeding professionally. However, we can teach people what is bandage, what is stopping the bleeding, what is the practical knowledge that need to be provided. And it's not only about Yaroslava, it's about anybody. The training is aimed even at teenagers. It's very simple. Question probably for everyone: how does business react to these initiatives, and how did the attitude of the business circles changed in terms of the first aid kits and the legislation about first aid? What is the situation? With your permission, I will comment. I know that we're a little limited in time. Business reacts insufficiently. It's always insufficient. And I would like to thank you for your involvement, because conscious business it joins these processes voluntarily. Good business is actively taking part in these processes, and these caps here are not just for decoration. We will return to them later. The business has to understand that no magical force will come and will not save us, and this is our main idea. That this is our main engine. We need to know how to save ourselves. Thank you. You wanted to add? Yeah, the thing is, the medical help for business, in my opinion, is one of the portion, has to become a portion of corporate culture. Like, for example, a donorship has become a portion of a part of the corporate culture, and it doesn't matter if the war stops or it doesn't stop. It has to become a component of the corporate culture, and this is our mini goal that we are aiming at with different trading chambers of European countries. We're working on inclusion of these training courses into corporate culture, and after that, to their surprise, the business will understand that it is better to be involved in these things. So I know from practice that people like that, people from business, they will not be trying to save people in emergency cases. They will be waiting for emergency services. Why? Because they don't know how, and they didn't undergo the training. However, after they receive this knowledge, it will help them feel safer, calmer, and because I will know that, for example, I will know that our workers are covered in case of emergency. So medical aid in 67%, this first medical attention is saving limbs in 67%, and this is very important. Those who understand it, they know that you have to trek for 1-2 hours, and so on and so on. Thank you. Yes, I would like to also add on my example, on my own example. Stop the Bleed courses, there were people that visiting us, and when I asked who is going to meet them, there were 8 people volunteered, and I, as a director, had to do a meeting, a discussion with them, why it is necessary, what is the actual goal of these activities. And after that, the my workers underwent the training, and they were very, very happy, because now they know how to actually stop the bleeding, because this does not correctly done on the first try usually. So they were happy that they learned how to do it, and there is a lot of details that has to be focused on when doing the bleeding stop. And I, as a mother of a 12-year-old son, and who is attending a school, and I would like for the teachers in the school, I would like for all of them to know how to save my child if something happens, and I go there and I talk to them, and I convince them that they need to undergo these courses. and I think that any person can actually influence whatever they need to influence to popularize these courses. The course Stop the Bleeding is small, and this is a very good opportunity for the business to increase the number of workers that take part in this process. So 10, 15, 100, 150, it is easy to send people for 1 2 days, and everybody is doing it. However, if you do a screening preliminarily of, for example, 40 people, 8 hours training course, but who of you can actually pass this course? The Stop the Bleeding course can be underwent by anybody, and these are knowledge that very important. This is a red thread I have in my hand, and we talked with Leonid yesterday, and we had the idea that this red thread has to become a symbol of first aid. There are different stories about these threads. Threads are in different stories, so we need to understand that it symbolizes a bandage, because this does not have anything to do with what we teach for stopping the bleeding. And however, it symbolizes something that compresses something that stops the flow. So people are becoming consumers in a more or less, and the consumers understand that the product has to be simple, understandable, and accessible. And this is the product that we're offering this training course. And these are the threads. If everybody agrees, of course, because it's going to be probably a heated discussion. So if everybody will be walking around with these threads on their hands, that they will remind everyone else that these training courses has to be underwent. And thank you, Mr. Serhiy. Any questions? Maybe comments? Yes, about caps. Yes, caps, and we don't hold. We won't hold you anymore. So Serhiy already announced this wave of maybe hate. I don't know. We have come up with this project, which is more humorous. Is it MAGA? No, it's M1. So this is our project is not political, and what we're aiming at is to create a culture of first aid in Ukraine, as a first country in the world. So we have come up. We're kind of humorous. We have come up with kind of humorous project, and these caps is the result of it. So I don't know if we will have the opportunity to actually wear them, but I know that we can make first aid important and great again. And we are ready to apply maximum force, but without the people, without the users, we cannot do anything. So we hope, and we are using every opportunity to achieve this. And we're thanking you. We thank Media Center of Ukraine and all my colleagues, everyone. If you have possibility, opportunity, if you have a desire, maybe you don't have resources, just come to us. We will help you to make the first aid great again. Thank you very much. I really do believe that you wanted to say something. Yes. Final word. So these training courses are the courses from the series attempts. They're testing courses, and for example, here we are distributing these small shoes that symbolize people that lost their limbs, and people are showing and the red thread is the same, but in terms of the first aid. And when you try it under the control of quality professionals, you will understand how you need to proceed in terms of if you want to become a paramedic, and this small push. It will maybe make this story global. Thank you. I will remind you, we were talking about the social responsibility in the first aid and safety of work, and this is a very important topic, and I do encourage everyone to undergo such a training. I already did it, and I will say that it does result in increase of self-confidence, and Media Center of Ukraine is keep this work in 15:00. We will be talking about the control and indoctrination of Ukrainian children by the state aggressor. Stay with us. Thank you.